Hello and welcome to another edition of Health Sense right here on 1FM 91.3, supported by Glen Eagles Hospital Singapore, on your side.
Now, Health Sense is a monthly series where we talk to a collective of medical and wellness specialists about a range of health matters. The theme today is in line with breast cancer awareness and osteoporosis awareness in October.
Okay, so we have Dr. Andrew Clayton Lee with us. He is an oncoplastic breast surgeon at Glen Eagles Hospital Singapore. Now, there are many things that we like about breasts.
Yes.
But cancer is certainly not one of them. Now, we've read an article in the Straits Times reporting that being female is an unmodifiable risk factor in itself because more than 50% of breast cancer cases are stimulated by the female hormones estrogen and progesterone. Right? So what are some of the warning signs that we should be looking out for? And as husbands and boyfriends, is there anything that we can do?
Right, well, first of all, don't you think it's a bit strange, three guys talking about breasts?
Yes, well,
no one talks about breasts in Asia, you know, apart from when you go to buy chicken rice, isn't
exactly.
it? Or fried chicken, you know.
Yeah.
So yeah, thank you for inviting me up here for the talk. So basically, the biggest symptom, the most commonest symptom for breast cancer is a painless lump, a lump in the breast. Especially the older the lady, the more likely that it is a cancer. Of course, we don't want to see ladies, as a breast surgeon, I don't want to see ladies coming to see me with a breast lump. I want to see them, if they're unfortunate enough to have breast cancer, to come with me with some x-rays to say, right, we've got this 5 millimeter cancer. Can you treat this for me, please?
Right.
Yes.
So, age does play a part.
Yes.
But what's the treatment then?
Well, the treatment nowadays is multimodal, so it involves surgery, a combination of surgery, radiotherapy, chemotherapy, and other things, and hormonal therapy. Of course, the combination will depend on how early we catch these cancers, and of course the type of cancers a lady has. You know, so the earlier we find these cancers, the earlier we treat them. So they may sometimes skip chemo.
Okay. So there is treatment where chemo is not involved then?
Yes.
Okay. So as you're watching this, if you do have any questions that you would like to ask Dr. Andrew Lee, then please just go to Facebook, put it down, and we'll ask those questions. Mammograms. My wife goes for mammograms regularly. How often should one go, and does it hurt?
Right. Well, the current guidelines, I think, I might be wrong, is between the age of 40 to 50, it's a yearly mammogram. And then after 50, it's every 2 years. My advice is really to have it every 2 years until a lady, maybe the health is not so good, then that's perhaps it's time to stop.
Right.
In terms of pain and things, you know, I've been a breast surgeon I've done breast surgery since 1996. And
okay.
Every time I walk past the mammogram room, I never heard a single scream.
Okay.
Yes. Okay. So if you do, but of course we can do a little research project, but maybe next time if you come, do a live show, we have all the sound sensor outside mammogram room and let's see whether there's any screaming. But
right.
To be honest, but when I tell ladies it doesn't hurt, you know, the ladies all look at me, yeah, but you're a guy though.
Yeah, exactly.
So I tell you, so what I did was, I went for mammogram myself.
You didn't?
Yes, I did. If you want to fact check, yeah, I did it at Glen Eagles.
Wow.
Yeah, it's okay. The scariest thing is really waiting outside, but actually inside it's all okay. Of course, some ladies may have sensitive breasts, so maybe the best time not to do it is immediately before or immediately after the menses.
Okay.
Yeah.
Do we have many men who go for mammograms? Because
I mean,
breast cancer can happen in men.
Can happen to a guy.
Men don't really need to because there's not a lot of breast tissue.
Yeah.
But I just did it because most ladies, when I tell them it doesn't hurt, they look at me and say, "But you're a man, though, you know. So how would you know?" So that's
Right.
why I did it. And quite funny enough, I gave a breast awareness talk last week. You know, I had 30 ladies in the room, and I said, "Hands up, who had the mammogram?" No one put up their hand. No, two did.
Right.
And then I put my hand up. That's true.
Why don't they go?
I don't know, because sometimes they think it's dangerous because of the
Radiation. Yeah.
You know, they might go out, you know, glowing in the dark. But actually, do you know the amount of irradiation in a set of mammograms is equivalent to 5 return flights from here to London? So if I give you 5 business class tickets,
Right.
to do it in 2 years, flying from here to London 5 times free,
Yeah.
would you say no?
No, I wouldn't. I'd take it.
Yeah, there's not much irradiation, doesn't really hurt. But then again, I tell you, but my wife still doesn't. She doesn't go. So
Wow.
yeah. She knows that I'm on this show at the moment. Can I say something?
Yes, please.
Where's the camera? That's
There,
there.
that one.
That's the camera.
Yeah.
Right, dear wife, you know who I am. You do your mammograms.
Okay, we've all heard about Angelina Jolie's double mastectomy.
Sure.
Could you tell us a bit more about oncoplastic surgery, breast surgery? What is it? How is it used in conjunction with other forms of cancer treatment?
Right. Okay. Well, Angelina Jolie has what we call inherited. She had these BRCA genes, which increases her risk of developing breast cancer. And for her to take these preventative surgery, reduces her risk of having breast cancer by over 95%.
Oh, right.
So this is one of the best preventative surgery that we can do. You know?
Right.
In terms of oncoplastic, basically it's just a made-up word, okay? Onco means cancer and plastic is plastic surgery. And basically it's to, well, essentially nowadays people survive breast cancer, you know, and people continue to have a long 10, 20, 30 years of living. And it's not just surviving, it's they have to look good, they have to feel confident.
Right.
You know, if I have patients who go for chemotherapy, a few years down the line, they'll just remember, oh yeah, I had chemo, hair fell off, that was it. Radiotherapy, they say, yeah, well, I can't remember what happened. But surgery every day, when they look at them, ladies, we're looking at themselves in the mirror, can see the surgery, the effects of surgery. So therefore, what we want to do is not only do the cancer surgery, spot on, everything cleared, but also to give the ladies a good cosmetic result. And I work with a few plastic surgeons, and what we can do is, you know, I recently had one lady who had the cancer in one breast, one is bigger than the other, and the other one was really heavy, she's having back pain. So what we did was we did the cancer surgery and together with a breast reduction.
Right.
I also had another lady who was a little bit older and the breast a bit saggy, you know, and so we managed to do the surgery together with a breast lift. So she ended up having a more youthful breast as well as a good cancer surgery.
That's
so
quite amazing. That is really okay. Let's get a little technical. If a woman is getting regular mammograms,
Yes.
does she still have to do those monthly checks?
Self-examination.
Self-examination.
Definitely. That's probably the best thing because mammograms are good at catching slow-growing cancers. Okay, we know that the more aggressive type of cancer can develop in short space of weeks and months. So from nothing to something can take as quick as 2-3 months.
Wow.
So that's why it's important to check them, ladies to check themselves once a month, 7 days after the start of menses, or if they are already stop the menses, the best day to do it would be first day of the year, first day of the month, or maybe payday.
Payday.
Payday, that would be a good time to check.
Payday. Okay.
Doctor, I've got a question here from one of our Facebook live viewers. Should breastfeeding women go for mammograms, and how accurate is the reading?
Well, I think with ladies who are currently breastfeeding, my advice is basically I don't think they need to have a mammogram screening. And the radiation doesn't affect the breast, so don't worry, the milk won't glow in the dark, so it's safe to drink. My advice is really, if they stop breastfeeding, then give it a few more months and then go and do the mammograms, because the breast will be quite dense because of the hormonal changes.
Right.
Okay. Now, we've been talking about mammograms. There's also breast ultrasound. What's the difference between the two?
Right. Yeah. Well, mammograms use X-ray. So what the X-ray doctors do is that they apply X-ray through the breast.
Yes.
And if you have a lump, the X-ray doesn't penetrate through the lump.
Right.
So it shows up as a white shadow.
Okay.
And breast tissue depending on the type of the breast tissue. Some ladies have very, very dense breasts, so X-ray doesn't penetrate it. But whereas some ladies who have more fatty breasts, so the X-ray penetrates it. So if you have a very dense breast, then you have a very white, and then if you have a white lump, you're not going to
see it.
So, to supplement it is to do an ultrasound, and on ultrasound, breast lumps tend to be darker, and the breast tissue tends to be whiter. So that's why you can see the contrast.
Oh, so it would depend on the type of breast you have,
Yes.
and that depends whether you do mammograms or
I think
breast
they
ultrasound.
should all do mammograms. Every lady should do mammograms, but maybe ladies with denser breasts should maybe consider an ultrasound as well.
Ultrasound as well.
All right, doctor, there's another Facebook question here. A lady says, on behalf of the women, like Angelina Jolie, should we check if we have the gene? Is the test expensive?
Yeah, how do you do it?
Right, okay. The best thing to do is to contact, I usually send my ladies to my oncologist for these BRCA gene testing. I don't advise every single lady to do it. The reason is because it's expensive and it also creates a lot of anxiety. And usually the ladies that we advise them to do it are those who have cancer at a very young age, in their 30s and 40s, and also with a family history. So, for example, their mother, their aunties, their cousins have all on one side of the family. Doesn't matter whether it's dad's side or the mum's side. If it's all on one side, then it's something to consider.
So as long as there's a family history, you should always try and get checked to see if you have the gene.
At young age, young age.
At a young age?
Yes, so if the grandmother had cancer at the age of 80, then that's not as important.
Hold on.
Yeah.
Speaking of history, there's another question right here, and I don't quite understand this. But she's asking if there is a history of breast cancer in the family. Is it true that we should avoid mammograms? Should it be the other way around?
I would have thought if you had the breast cancer history, you would want to have mammograms.
But I just read the question.
Well, I think this comes back to, is mammogram dangerous with all the irradiation? Will that cause breast cancer? But, the amount is very small. It's equivalent to, apart from 5 flights from here to London, it's equivalent to living on Earth for 7 weeks. Because we have irradiation from our surrounding, in rocks and solar irradiation and,
Just very quickly, how does a lady keep her breasts healthy? How does she reduce her risk of breast cancer?
Right. The best thing, in my opinion, is to have a healthy weight, because when we know ladies who are overweight and severely overweight, the risk of breast cancer increases. And it's, in actual fact, if you look at all the cancers, there is a general increase in all types, like the cancer of the womb, esophagus, pancreas. So the weight, maintaining a healthy weight is very important.
Right.
Secondly is daily consumption of alcohol. Yes, alcohol is a known risk factor for breast cancer, and it's for daily drinking, so as a breast surgeon, now I refuse to buy all my female friends an alcoholic drink. They all have to drink orange juice.
Well, good for you, good for you.
It's good for the wallet as well. Anyway, alcohol, smoking, and it's the number of cigarettes smoked per day, smoking at an early age, and smoking before having the first child. That's also risk factors.
That's interesting. Smoking before having the first child. I wouldn't have said so. What about foods?
Yes.
Anything they should be taking, shouldn't be taking?
Right. There is a new research, very newish research from France, where they studied a population, and they found that eating processed food specifically increases the breast cancer risk by 10%. So processed food, as in your nuggets and your fried chicken,
right?
All the convenient food, Coca-Cola. I'm supposed to name names.
Well, yeah,
sorry.
Yeah. But there are also all these. You see it on the internet. There are all these wonder things. You should be eating this vegetable. You should be eating that vegetable. Superfoods that will help reduce the risk of cancers. Any of that true?
Well,
in your opinion.
I haven't come across any solid evidence.
Right.
But to be honest, it would be arrogant for me to say no.
Yeah.
But of course, I cannot honestly say yes, because there isn't scientific evidence to
Right.
prove so.
Doctor,
Right,
what if we say everything in moderation? You mentioned alcohol earlier on. I mean, these days, the occasional glass of wine or two.
Yes, of course. Well, life is there to live. You know, you have to enjoy life.
Right.
But I think moderation, as you said, no, don't drink on a daily basis. I think.
Right.
Good stuff. Dr. Andrew Lee, thank you so much for talking to us about this. It's been very, very insightful. It's been wonderful having you with us. Thank you so much.
Thank you very much.
Good times. Greatest hits. 1FM 91.3.